Jackie, it's so lovely of you to give time to me and us today to discuss your work, because what you do, I feel, is truly wonderful. It really, really is. It's not obviously our favorite time, but to make our dogs and animals, other cats too, obviously we're predominantly talking about dogs today, lives at the end of their life more comfortable is just so important. But I think a lot of us have very little idea how we can really approach that. So if you could just very briefly explain how you got into palliative care.
Yeah, so look, my journey into palliative care and look, palliative care in the veterinary field, I guess, is still relatively new. I think, all veterinarians do practice palliative care to some degree in their daily practice, but it's very much becoming an area where, some veterinarians are really looking to sort of specialize their skills. And I think there's two factors to that. One is that, we are so prepared to walk with our pets through that journey for longer than I think ever before. There's some incredibly committed and loving and supportive families out there that, will do anything to keep their animals comfortable. And I also think just, our ability to sort of impact their wellness at that point is growing. So, veterinary care and all of the, other things that surround that. So physiotherapy and skills like Galen and the team members that you have delivering those supportive skills, all of those things are really advancing, massively. We have better access to care and better medicine than ever before. So those two things, I think, really go hand in hand. And, what it means is that in general, our pets are living better for longer. But it does also mean that we need to be, I suppose, ever more cognizant of aging and age-related changes and illness at the end, because there certainly are, quality of life concerns. And so it is becoming an area where we really need a bit of specialised support and advice around what to look for, what to do as we're kind of approaching the end. Managing, crisis moments for those pets, periods of time where they've got, severe breakthrough pain, those kinds of things can occur. So, look, I think, my journey really has been one of incremental, step by step, becoming more and more interested in being a really good palliative clinician and being able to sort of have conversations with owners that we know want the best for their pets, but maybe, need a bit of guidance around some of these sometimes very emotional conversations. We don't always want to have them.
Well, exactly. We all know that our animals live for such a short amount of time, relatively, that we all want, well, everyone I know definitely wants the best for their animal. And sometimes I think maybe it's difficult to start a conversation with your vets. It's not that they're difficult to talk to, but we all know we have quite a short amount of time through a consult, and to try and express what we feel or what we want. Are there sort of maybe ways that we can help people express themselves to their vet that might sort of open up this subject a little bit more for them?
Yeah, look, absolutely. And I agree, I think more and more our vets are very, very busy, and it really is about, I guess, honing in on what are the things that we really need to focus on with respect to quality of life. And one of the challenges that all veterinarians have is they need to look at the very medical side of things. And I think the challenge that our owners and our pet lovers have is helping those vets to see the things that they maybe can't see in the hospital and in the clinic. And we would encourage you to sort of talk to your vet about the things that impact quality of life for your animal on a day-to-day basis. So this is talking about changes that you're seeing in the home environment. I'm personally very, very lucky and blessed in the capacity that the practice I do is actually done in people's homes. So we're a mobile team. We work alongside the veterinary hospitals, and we'll go into the home, and we get a lot more information, I suppose, about how those animals are actually living. And we're really looking at things like their bedding and their flooring and their environment. And we know that when our animals go into a clinic, it's much like us going into a hospital. There is a bit of an adrenaline kick that happens, and they won't be presenting the same postural changes and the same behavioural changes that you'll see when they're in a relaxed state at home. So it's sometimes very, very hard for the vet in 10 or 15 minutes to sort of take an assessment of those things. And I think there's definitely ways that owners can kind of help, cross that barrier of communication. So photography and video is actually a really great tool and a resource. And I know that, your Galen team, Julia, do this. We kind of look at those postural changes over a period of time. And that's really helpful for vets. And they'll love you if you present them in with some comparable imagery or videos of the things you might be concerned about. But I think even languaging, just being brave enough to sort of introduce the word palliative for me is really, really helpful, because what that word means is that I'm an owner that is really concerned about comfort solutions for my pet. So I'm worried about their pain levels, and I'm not so worried, or maybe not as worried as I was previously, about let's treat everything to cure at all costs. So there is this mindset shift that the word palliative gives us permission to say, okay, there's been a shift. What are our new goals for their care? And where are those goalposts sitting? And for most people, by the time we are starting to talk about palliative care, it's really about comfort, not cure. And I think that's a really powerful place for owners to feel like they can be empowered to sort of lead that conversation. And vets are very, very receptive to that. One of the challenges, I think, for vets is that word can be confronting for some owners. So emotionally, if those owners are not yet there, it can be very hard for the vet to say, look,
no, I want to cure my dog. Yes, absolutely.
So if what is important to you is pain-free and comfortable, if that's your leading priority, depending on what stage you're at, I'd absolutely say to owners, look, mention that word, let the vets know this is where my headspace is at, and this is what our priorities are. It's absolutely not about giving up in any capacity.
No.
Actually about improving the quality of life. And sometimes for us, that means we're actually taking away certain medications or shifting our focus and really trying to support them being comfortable. So things like, how well are they sleeping? How are they resting? Those are the things that suddenly are just pushed up the priority list. And I think that's a really, really powerful place for owners to be coming from.
Absolutely. As you say, it's about demonstrating your own personal as a guardian of your animal, and your intention that and it cuts straight through. I'm actually willing to also invest time and money in this. I want to look at my dog's overall, or cat's overall, comfort. And I think it's very interesting that you mentioned sleep and making and enhancing rest and sleep, because so often and we all know that it's very difficult. Dogs keep their comfort quite a closely held secret, how they feel. I mean, we can recognize it, but I think it's when it's your own dog, it's very difficult to know what stage of comfort or pain they're in. And I think often it's they're still eating, so they're okay scenario goes past. We know that there are many, 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 many increments between comfortable and pain and eating and not eating. So I think that's a great tip, to just mention that word palliative, but also it can be, as you say, quite a harsh word to hear, but that's just such fantastic advice, because we've got such a shortness of time in our consult, but that word palliative really does cut through. That's fantastic advice.
Yeah, I mean, look, for me, it's really not meant to be harsh. I think it's really meant to be a word that empowers people, and all that it suggests to those around us is that I'm really conscious that time left is now precious, and we want that time to be the best possible time it can be. So, you know, we make different choices in that period of time, and for some families that can be many, many, many months, but it's really important that those months are, you know, the priority there is not all about more tests and diagnostics and more treatment. It's really about what's important to that individual pet, and that pet and that family as a unit, you know, need to be very involved in those decision-making processes.
Absolutely. I mean, sadly, we can't roll back the time for anyone, but as you quite rightly say, we can make our time, their time, much more comfortable, and then make better memories too. And also, I know that there's a lot of guilt that we all have. However hard we try and make our animal's life the best, there's always something at the end. Could I have done more? And by exploring these avenues in this way is going to help so many people. I know that.
It absolutely reduces regret, I think, because we're having these informed discussions about what we want. And what that means is that we're less likely to have a situation where we receive what we don't want for our pet. And for us in the palliative care world, you know, that really means those families where there is a crisis point and we end up, you know, with a situation where goodbye happens in a way that we didn't want for that animal. It's in the hospital, they're stressed, mum and dad are stressed. So being, you know, brave enough, I guess, to start those conversations early means that we're going to reduce the risk of those crisis moments. And, you know, it can be a really empowering place for us all to be. And yeah, look, it's about making those memories as well, a really important part of it. So, you know, asking for guidance around what you want in that period is really helpful for both the vet and for you.
Absolutely. And we work a lot, as you've already said, with older dogs, and we see massive changes with myotherapy. Huge changes in their quality of life. No, we can't change their age. Sometimes I think people put things down to old age, and it actually is just them feeling stiffer and slower. So that obviously can help. But we see things, and we've seen some big changes working with some amazing vets, and working in partnership, as you mentioned, with other modalities too, can really help, can't it?
Oh, massively. You know, I think one of the things that's definitely changing in the veterinary world is we're recognizing the skills of these other team members. And, you know, certainly the big one for me are groups like animal physiotherapists and hydrotherapists that are doing a lot of great work, and certainly Galen fits into that category, where, you know, we're maintaining muscle mass that you know is somewhat beginning to hold at bay the aging process. So really, really critical. It's really common in human healthcare that, you know, as we get to that stage, we have regular support from those services and those health professionals. And I think our animals totally deserve that. And it makes, you know, a massive difference. You know, in my personal opinion, we absolutely need drugs on board and pain relief on board for our animal at this point. But it's actually often the physical therapy and the hydrotherapy and
keep them
other
moving.
adjuncts that keep them going. So yeah, I agree. I see massive changes in some of my elderly patients that are quite stable, and we're really honing in on quality of life changes. And for me, you know, musculoskeletal pain is such a big one. It's so common. It's way more debilitating than I think we realize.
Definitely.
You know, it's certainly something when you talk to human patients with it, and they give you a different perspective to, I think, what we feel is likely the case with our animals. So
it's just
really
this
important.
wearing pain. Yeah, absolutely.
The chronicity of it. fatiguing.
Absolutely, absolutely, which of course affects the behavior, the brain, everything. It's just, keep the body moving as much as possible, keep the cells active.
And one of the concepts in palliative care is, with respect to pain, is this concept of total pain. And so total pain specifically relates to not just the physical pain of an illness, but it does encompass that emotional anguish of whatever the illness is. And so I think if we're not tackling that, we're really doing our pets a disservice in some ways. We know that they are feeling, fatigued and lethargic and restricted by their pain. And if we can tackle both of those angles, we're going to get much better results for our patients.
Totally treat the whole body. Absolutely.
Including the mind.
Absolutely. Mind and body. Jackie, thank you so much for your time and a share in your expertise. I honestly am in awe of the work you do. I really am. When you first told me this is where you were going all those years ago, I thought, wow, this is what we need, specialisms within palliative and sort of end of life. So thank you for doing that. And thank you for telling us all today about all the wonderful work you do. So thank you for your time.
My pleasure. Thank you, Julia.
We will catch up again soon, I really hope.
Definitely.
Thank you. Bye-bye. Bye.